UPS is working to reduce contact between drivers and customers. During the pandemic, drivers will no longer be asking for signatures. They'll just make contact with the recipient and then request ID if necessary. UPS says this move is temporary, of course, to reduce the spread of COVID-19. The World Health Organization is encouraging people to play video games during the pandemic. The U.S. ambassador, who tweeted his support, asked people to help continue social distancing efforts by picking up a game. Now, in the past, the WHO classified video game addiction as an official mental health disorder. Several U.S. game companies are joining the movement by making certain content free. Our National Investigative Unit is getting answers to your coronavirus questions. You wanted to know what specific symptoms of coronavirus you should look for and how they're different from allergies or the flu. Chief National Investigative Correspondent Mark Albert asked the doctors.
Priscilla wants to know exactly what are the symptoms. She says she's been seeing a lot of news coverage, and to her it seems like these are flu-like symptoms, and so she wants to know, does everyone get a fever, or can you have this without a fever? Dr. Wen?
Great question about the symptoms. So the most common symptoms of COVID-19, the novel coronavirus, are fever, shortness of breath, and cough. Less likely sneezing, runny nose that distinguishes it from allergies or from a cold. Some patients also have what are called atypical symptoms. They may feel achy all over, likely because of high fever. They may have abdominal symptoms, have nausea, vomiting, diarrhea as well. But these are all fairly nonspecific symptoms, such that a person who has another type of virus may well have these symptoms too. There are also people who have very mild symptoms or no symptoms at all and could still have COVID-19. This is why, though, testing is so important. It has been a major point of frustration that we haven't had enough testing here in the U.S. because it's a point of frustration for clinicians and for patients. I mean, it's frustrating to be told, you could have COVID-19, we just can't test you, so go home and self-isolate. That may be the right thing to do if we have no test, but it is frustrating. It also really hampers public health efforts, because if we do not know the true spread of COVID-19 in our communities, it also significantly limits our ability to figure out what interventions should be done.
It's more than just the symptoms of a common cold or allergy. You're sick, you have high fever, you're in one of these compromised host groups.
In Washington, I'm Chief National Investigative Correspondent Mark Albert.
We know you have a lot more questions about the coronavirus. You can watch our latest hour-long National Investigative Unit special with a panel of medical experts. It's on our KMBC 9 Facebook page right now. There is some cutting-edge research that could possibly lead to a treatment for COVID-19. The answer may lie with the patients who were strong enough to fight off the virus. A growing number of hospitals are working on it right now. Experts say antibody treatments could help patients hospitalized by the coronavirus recover until effective treatments or an approved vaccine are available.
If you give the plasma, a portion of the blood that contains the antibodies, it may help the patient overcome the disease. And so our plan is to infuse this into patients with moderate to severe illness who are in our hospital.
This man, a 31-year-old lawyer who recovered from the virus, just got word that he can help someone else.
And if I have, a resistance to it that can then be helped to somebody who's elderly or somebody who's sick, I would feel honored to do that in any way that I can.
The hope is that some volunteers could be, in effect, super donors who may have high levels of antibodies and could end up helping more than one patient. Thousands have offered to donate to New York's Mount Sinai, but they tell us every donor has to have a documented positive test and be at least 21 days from their first symptoms. We're still in the early stages of this pandemic right now, and our Michael Mahoney says that's important to remember. Here's Mahoney's Minute.
Last week, the baseball season was supposed to start, so let's talk about where we're at in the old COVID ball game. 1 week into this metro-wide stay-at-home order, we're just in the first inning, but some folks think we're deeper than that, and that appears to be wrong. At a briefing last week, KU doctors were blunt. Stay at home. We could bend the curve, and we won't know for about 2 weeks. That would not be the end, that would be the bend. Doctors think comparing coronavirus to the flu is misleading at best and may be dangerous. They know a lot more about the flu, and there are vaccines to fight it. There's no coronavirus vaccine yet, and there won't be anytime soon. And it's compounded by a clear lack of preparedness, resulting in a supply problem. Kansas Governor Laura Kelly says last weekend, the entire state almost ran out of testing kits. And this push to reopen the city and the nation's economy is wrong now. Remember, we're in the first innings of this stay-at-home game to bend the curve. So, like they say, let's play ball. That's my minute.
Many schools and universities like KU and Mizzou have shifted to online learning during this difficult time. At the University of Tennessee, one class was greeted with a famous grad who used the alias Mr. Thompson.
Mr. Thompson, I think you were late for class.
I'm sorry, Dr. Haas. It's been a while. It's been at least since 1996, 97 since I've been in class, so I apologize.
Well, if you were here, I'd be making you run the stadium steps for being late.
NFL great Peyton Manning there. He was hoping to boost spirits with his guest appearance. Looked like it worked. Manning graduated from the University of Tennessee in 1997. And while kids are learning from home, you can visit the KMBC 9 Classroom this week on Facebook Live. It's a way to learn something from us here at Channel 9. Each day we'll teach you something different. Tomorrow, First Alert meteorologist Nick Bender will be talking about tornadoes, how they form, how to stay safe, and more. He'll even answer your questions. On Tuesday, Rachel Sanchi talks about cooking. And on Wednesday, Thursday, and Friday, our First Alert meteorologists tackle your weather questions, including thunderstorms with Neville Miller on Wednesday. KMBC Classroom airs every weekday at 10 a.m. on Facebook Live.